thrown into the bath.
It's not a drug.
I want to ban these things. This is just the shonk end of medicine when I can pick up a device, allegedly hold it in my hand, and as it says here, cure cancer, all types, pathogens, HIV/AIDS, hep viruses, and all diseases. That's nonsense. They need to be stopped. We intend to stop them. I frankly am staggered when I began to inquire about the range of bogus claims for health cures that are in the marketplace. They're out there because, frankly, there are vultures who are preying on people's fears, their anxieties when they're at their most vulnerable, when they're sick. And when you look at this array of offers, you see just how vulnerable some people can be. When I can buy for $100 a bodged together part of a toy from Tandy, whacked together with a couple of bits of copper pipe and a 9-volt battery and be told that'll cure AIDS or cancer, you start to wonder where these people's scruples really are. The Therapeutic Goods Administration generally controls products coming into the market, but they control them in the context of them not causing harm. Well, this won't kill you, but it's not going to cure you. The ACCC, the Healthcare Complaints Commission, earlier this year conducted a sweep of the websites offering miracle cures. They're on the increase, 77 sites in New South Wales alone, and I want to make sure that we are not going to let people slip through the net because of either loopholes in legislation or the absence of regulation. Today I can announce, therefore, that I've appointed Professor John Dwyer to head up a team who will oversee a full review of all legislation and regulations when it comes to the production of these bogus toys that promise false hope and false cures. You can't do anything other than do that, but we're going to stamp these out, and we'll do it properly by legislating where necessary, regulating where appropriate, and of course making sure the rest of the Commonwealth, through the Health Ministers' Council, follows our lead. I had thought that probably what I would see today when I asked for these implements to be brought in were things that were less confrontational. But when you see something of this nature, for $100, a promise for a cure for AIDS, a promise for a cure for Hep C, a promise for a cure for cancer, it is just wrong and needs to be stopped. We will stop it. John, can I just ask you to talk about some of the detail of this? This has been one of your passions for a long time.
Yes, thank you, Minister. I mean, before us here we have, this is, as Craig said, this one's made up from a commercially available toy. You have more sophisticated models, looking models that are available for $450, and they actually range up to big machines with computers attached to them for $1,600 or $1,700. You know, we've all had a terrible problem recently with meningococcal disease. We do not, unfortunately, have a vaccine against all of the different types of meningococcus, and unfortunately people die and will continue to die until we can get a proper vaccine. How cruel, therefore, to have homeopathic preparations claiming to be vaccines against all sorts of infections, hepatitis B, hepatitis C, all types of meningococci, tuberculosis, malaria, available and foisted on the public. And of course the big question is, how come in 2002, in the most scientific of all ages, this sort of thing can happen? There's a little microscope here that is sold to consumers, to women in particular, that says it's basically a do-it-yourself pap smear machine, which claims that women can detect dangerous changes in their secretions and replace a pap smear. Total nonsense. And we could go on and on because there is an endless array of bogus devices. The most sophisticated and expensive ones are offered by alternative laboratories, of which there are a number, where they will gladly relieve you of hundreds of dollars for these bogus tests. Now, I suppose from my point of view as a doctor who looks after people with chronic conditions, sometimes incurable conditions, I've become interested and worried about it over the last few years, and have answered for myself this question: does it really matter? I mean, would any sensible person fall for this sort of nonsense? But in my clinical practice, I've seen judges, doctors, scientists with cancer, say advanced cancer, desperate for hope, and someone offers them false hope, and they'll say, well, maybe I'd better give it a go. People suspend their normal common sense when they're extremely vulnerable, in pain, worried, desperate is not too much of an exaggeration. Now, surely as a society that values consumer protection, we want to protect people from this sort of thing. You may have heard, there was quite a bit of publicity recently about a little baby that was born with terrible congenital heart disease. If the baby wasn't operated on in the first 3 weeks of life, the baby would definitely die. The cardiac surgeons informed the parents of this. A naturopath said, after using one of these bogus diagnostic machines, that some South African herbs could cure the baby, treated the baby, pronounced the baby cured, the baby died. Now, we have had, in recent times, wonderful cooperation from ACCC and Fair Trading in chasing a number of people who've been making false and fraudulent claims. But there are literally thousands of these claims out there, and really we want to try and look at how we can protect consumers by stopping this thing before it gets started. We don't want people to be able to take your money, claim to be a health professional, and give you dangerous, bogus advice and use these sort of devices. So it's a serious issue, and I'd like to congratulate the government for taking this on. As someone who's been advocating for this for some time, I must say that in my past experience, this has often been put by politicians in the too hard basket, both at the state and federal level. As far as I know, this will be a first in Australia, and speaking on behalf of so many colleagues, clinicians, doctors, nurses, allied health professionals concerned about this, I think we're all very grateful that we're going to have the opportunity to see if we can't improve consumer protection in this area.
I'd like Adrian to say a few words as well.
Well, the Healthcare Complaints Commission was set up in 1993 primarily to protect and promote consumer rights. So the Commission applauds any opportunity to achieve that aim, and certainly there have been areas in our policy and legislation that there are gaps to enable this sort of therapy and device to be available to consumers. And certainly if you look at the advertisements for these, you can see why people can be hoodwinked. The information that's provided is verbose, lengthy, and I guess gives the effect of promoting science and the scientific basis for them. If we can make sure that the efficacy and safety of these devices and therapies can be tested before they become available to consumers, the Commission certainly would support that, and applauds also the opportunity to look at where the gaps and barriers to consumer safety exist now.
Excellent. Question?
Minister, when you say crackdown, I mean, how do you find these things, and then what do you do once they're found?
Well, that's partly John's task over the next 6 months as he undertakes the review, but clearly the initial scan by the ACCC and the HCCC identified a number of websites marketing this sort of material. That's one starting point. There are people who advertise in the newspapers. We'll be conducting a full review. I guess the message to anybody offering this sort of rubbish is we're going to check you out. We're going to check out whether there's any clinical benefit in the claims you made, and if there's not, we'll close you down. And it's as simple as that. I just think it's obscene that with the Saturday morning shopping trip to Tandy, you can market an HIV or a cancer cure. And I'm staggered that these devices exist, and I intend to close them down.
What's the fine though if you could? What happens?
We'll be building a penalty regime. It will be strong.
Jail time?
I don't know. I'll see what John delivers, but I think the message to the community is don't fall for this sort of nonsense.
I think clearly there are got to be two tactics here. First of all, we will look at ways of better educating the public to protect them so they can protect themselves. We've got creams here, for example, that people are selling, saying they can, if you rub this on, it will cure your melanoma. We know in Australia melanoma is a terrible cancer, and we want to be able to try and help people while we're trying to work out how to ban these and banish these things from sale. We want to educate consumers so they can protect themselves. There are creams here claiming to be able to cure breast cancer. Finding these things is easy. You can practically any magazine you open up today, popular magazine, will have 3 or 4 offensive, false advertisements asking for money. Listen to this tape at night and change your brain waves forever, and you'll never suffer from anxiety again. Take this tonic for this and that. There's blatant advertising of this sort of material and this sort of bogus device in many, many sources. We are planning to set up for our committee a hotline so people can call us in and tell us about things that have concerned them, where they may have felt they've been ripped off by one of these shonky so-called health professionals. But education, and then trying to change the situation around so that those people who want to put any of these things on the market have placed on them the same onus of proof that's placed on orthodox medical scientists. If you wanted to market, say, a new antihistamine, if a major drug company wanted to market a new antihistamine, they would have to spend millions of dollars preparing the proof to convince the Australian Drug Evaluation Committee and others that they had a good product. With this thing, we want to put the burden of proof back onto the people who make these outrageous claims, and if they can't convince an appropriately expert committee, they simply won't be able to market these things.
But if you already know those products are dodgy and you say they're false and they make misleading health claims, why can't you take action now? What is there to review?
You can take action against false claims, and ACCC and Fair Trading have, and I've been involved with some of those. But there's a number of problems. First of all, that's after the event. And like we saw with the tragic story of the little baby that died from heart disease, the question you'd have to ask there is how could that happen? We want a situation where someone can't use a bogus device, tell parents that they've cured their child of major heart disease. Chasing after that person, penalising them, even jailing them is not going to help those parents and that baby. The second issue is that we have, at the moment, a situation where even if a particular bogus device is brought to the attention of a court, and the court might fine, as has happened recently, a naturopath using a technique called live blood analysis, that doesn't stop the 180 other outlets using the same device from continuing to use it. The judgment is against the person, not against the bogus device. So there are a number of loopholes. But the major emphasis, we hope that the major emphasis in our work, I hope, will be education and swinging around, if necessary, through legislation, to putting the onus of proof back onto the people that are making these outrageous claims, whether it's magic water or vaccines.
Here's a device that promises on program 2 to deal with AIDS and on program 3 to deal with cancer because of the different frequencies that emits through these pads that you strap onto your liver and your spleen. Well, this doesn't need to go near the TGA. The ACCC could certainly pursue it, but it's out there. We want to make sure anybody wanting to market this sort of stuff have proven their case that it does deal with cancer and AIDS before it gets into the marketplace.
But surely that's the point, though. I mean, you're identifying these products now as having a potentially deadly impact. I mean, if somebody is turning away from a regular treatment to use these, they could be putting their life at risk. Surely we should be doing something now to protect the public.
Well, I think the quickest way of protecting the public is to upscale our education efforts, to warn them and to give them some information, practical information about how they can judge claims made. And in the case of people who are desperate and whose judgment might be clouded, in my experience, it's very necessary to involve family members to have a rational conversation about these things. It's not that some of the things that are available are actually dangerous. Some of the herbal preparations that are available can actually cause people harm, but most are harmless. But they certainly, in many cases, keep people away from treatment that might be effective. One of the things in my area of specialty, which is in the HIV/AIDS area, that's really distressed me recently is that most of the patients I see now with AIDS, now that we have very effective drugs, are people who have put their faith in alternative practitioners and their bogus therapies, and been told that they would not get AIDS, they didn't need these modern drugs, these natural products were better, and of course have had their immune system destroyed and turn up at the hospital. It breaks your heart when you think of the fact that this is totally unnecessary in this day and age. It's a matter of education, and then for these extremes, finding a way of putting the brakes on this flourishing industry. Australians are spending almost $2 billion a year on what, in this most scientific of ages, we know is largely unscientific methodology and practice. And an education campaign, and if necessary, some changes in legislation is what we'll be after.
There's long been obviously a rivalry, not from the right word, but friction between the alternative side of medicine and more orthodox and Jewish. Why can't the alternative side of things see this as being just a witch hunt?
No, the alternative side can take over. Just a week ago, some of you may have issued a discussion paper around comparative and traditional Chinese medicines, for example. This is down the Dodgy Brothers end. This is the stuff that tells you when you buy it, you're buying it to cure cancer. You're buying it to cure AIDS. It doesn't. It can't. Obviously the case. And this is where we're pursuing. These sorts of snake oil salesman type practices that see people giving people false hope. $100 cure for cancer or AIDS would be something that would take the world by storm. If it was real, it's not. But it shows you just how desperate people can be when they're sucked in by this.
Can I just comment on that question, though, because it's really important. I think that the attitude that most clinical scientists are taking these days is that there's only two types of medicine, good medicine and bad medicine. Good medicine is practiced by doctors. It's also practiced by a number of naturopaths and people who give perfectly sensible lifestyle advice, etc. Bad medicine is practiced by a lot of so-called alternative practitioners and some doctors, some nurses and the like. And one of the issues that we'll be looking at is whether we need to have more power for the New South Wales Medical Board or Nurses Registration Board, etc., to look at some health professionals, some doctors, people are registered by the New South Wales Medical Board and are doctors who are practicing an unacceptable standard of medicine, who have sort of given in and saying, look, we'll combine these practices. And there are a number of clinics in Sydney run by doctors, run by nurses that are practicing quite deplorable unscientific medicine. And if we all concentrate on what's really good and what's not good, and look at how we can promote what's good and help people avoid what's bad, then we'll all benefit from it. We need to get away from the whole concept of that there is an alternative or complementary medical practice out there that's quite different from orthodox. The best of both needs to be combined, so we're just practicing good medicine and avoiding bad medicine.
But Minister, if these are so obviously useless, why can't you take them off the market now?
Well, I would like to take them off the market now if we can, we will, and that's why we have rules around fair trading law and all those sorts of things, but you're pursuing them after the event. Some poor devil is out there using this today, thinking that they're curing their cancer or their AIDS. Maybe by watching your news tonight, they'll think twice and go and talk to their doctor, but in the meantime, we're going to review all the legislation and make it so much harder for the mongrels who sell this stuff and take advantage of people.
This is the bottom end of the market. The top end of the market involves very elaborate looking laboratories where you go along and spend lots of money and have lots of fraudulent tests done upon you. At the top end of the market, it's very well organised with franchising of very expensive devices, often imported from Germany or somewhere else overseas, and usually involving some sort of pseudo-computer technology. And in many homeopaths and naturopaths' offices, you'll find these devices that people use and charge a lot of money for. And one of the areas that is most distressing to me and to many of my colleagues is that a number of our private health insurance funds are not being at all discriminatory about the the things they'll pay for from the alternative industry, and in a way that I presume they don't realise they're doing, they give an imprimatur, a blessing if you like, or some credibility to some of these tests, like the live blood analysis that was just very roundly criticised in court. You can get a rebate for that from some private health funds. So the whole issue needs to be brought out into the open and examined thoroughly, all with the view of educating the public and protecting the vulnerable.
Thanks. And this one will fix your cancer and your HIV as well, and Hep C. Thrown into the bargain.
100 buckets.
It's not a drug.